Our last title is committee print regarding the state Medicaid fiscal relief. Without objection, the committee print will be considered as read. Clerk will designate section 1 to open up the amendment process. Just say section 1.
Title V, Medicaid Provisions. Section 5000, Table of Contents of Title.
The chairman has an amendment in the nature of a substitute, and I ask unanimous consent to consider the amendment as read and as base text for the purpose of amendment. And without objection, amendments drafted to the committee print regarding Medicaid fiscal relief are made in order to this amendment in the nature of a substitute. This amendment contains a minor change to the text. It adds a section 5007 that would temporarily raise the Medicaid dish allotments for all states in fiscal years 2009 and 2010 by 2.5% each year. Majority and minority staffs have been provided with the text of the amendment and a brief summary of the changes, as well as a CBO estimate. The title is a temporary response to the double whammy. The New York Times described it today on a survey of 40 states. It finds that Medicaid enrollment is growing rapidly. In some cases, the surge has overwhelmed social service agencies, and the states are being asked to meet this demand exactly at the time as the recession is driving down their revenues. This draft will give the states additional assistance under with their Medicaid costs for the period October 1, 2008 through December 31, 2010, when hopefully we'll be through the worst of the recession. Under the text as amended, all states will receive a 4.9 percentage point increase in their federal matching rate, or FMAP. States with high unemployment will get an additional increase designed to give the most help to the states with the largest increases in unemployment, and no state's regular matching rate can go down. The Texas amendment also included additional changes that will help state Medicaid programs during this recession. It would extend the current moratorium on Medicaid regulations for an additional 3 months to give the Obama administration enough time to dispose of them through notice and comment rulemaking. If these regulations are allowed to go into effect, state Medicaid programs will lose $200 million in federal Medicaid funds in just 3 months, and states simply can't afford it. It would extend existing Medicaid work transition provisions until December 31, 2010. It would give states the option of covering family planning services for uninsured low-income women who are not otherwise eligible for Medicaid. This is a critical prevention initiative that actually saves both the state and federal government money by helping to reduce the number of unwanted births. It would protect Indian Medicaid beneficiaries from cost sharing when they receive care from an IHS or tribal hospital. It would require both the Centers for Medicaid and Medicaid Services and the state Medicaid and CHIP agencies to consult with tribes when making policy decisions that affect them. And finally, the bill would temporarily raise the dish allotment for each state in fiscal year 2009 and 2010 by 2.5% in each of those years. CBO estimates the cost of these provisions at $89.5 billion over 5 years. And given the size of the Medicaid crisis states are facing, these seem like a modest response. So the amendment in the nature of the substitute is before us, and I will call on members who wish to offer amendments to this title.